One condition we treat in my office is trigger finger. So trigger finger is a condition where the tendon that moves our finger becomes inflamed, and then that tendon cannot slide properly, causing the finger to get stuck, usually in a flexed position like this. So what will happen is from repetitive use, and hence they came trigger finger because you're using your index finger to pull the trigger, but this can actually happen to any of the fingers. Most common, I would say, is going to be the index, followed by either your ring or middle finger along with your thumb. What will happen with trigger finger is as you flex, it'll be hard to open up that finger, and it almost like will snap open like that. And it can be very painful. It'll create a lot of stiffness inside the joint. And so what I want to do today is I want to talk about how we fix trigger finger in my office. There's a few treatments we use to help fix trigger finger. One technique is going to be called Graston Technique, where I take an instrument over the tendon to help loosen up any adhesions or any scar tissue that's in the tendon or along the muscle tissue around it. The second technique that we use is a treatment technique called Shockwave Therapy. So Shockwave Therapy sends a shockwave into the tissue to help, again, increase the blood flow to that area, help break up any adhesions, and help to loosen up any of that tension along that tendon. Works really well if there's any scar tissue, any muscle adhesions in that area, and that can actually get very deep into the tissue to help relax that and loosen up that tendon. Finally, because this is usually an inflammatory type of condition, we'll apply laser therapy over the tendon, and we'll trace that all the way up into the palm. And what that does is it helps to calm down that inflammation, which will allow that tendon to slide properly. Now at home, what you want to do is you want to typically wear some kind of brace over the affected finger, and that'll help prevent it from getting stuck in that flexed position. Especially important if you're sleeping at night to wear that brace over the finger as well. So a lot of times we sleep with our hands clenched like that, causing that muscle to contract all night long. So when you get up in the morning, it's really stiff and uncomfortable to open up that finger. And then as we get the range of motion back, we want to help to reinforce that range of motion by moving it back and forth. And then we want to reduce the amount of stress that we're placing on that finger. So if you are doing a repetitive motion, say like on a mouse all day long, or another thing where you're gripping and doing a lot of repetitive stress, we want to try to minimize that as that tendon is healing. So I'm going to demonstrate what these treatment techniques look like, and I'll talk more about them. So the first technique we're going to use is called Graston Technique. So Graston Technique uses a stainless steel instrument, and basically it has a certain edge profile to it. So when I take it over the tendon, it's going to help to massage and loosen up any of that tightness or any of the adhesions inside that area. So what I'm going to do, if I'm working my index finger, I'm going to lightly kind of massage at a certain angle with the Graston tool, and we're going to get in there and help to loosen up any of those adhesions around the tendon. Now you want to be careful because it can be inflamed, and so you got to go to the patient's tolerance, but we're basically just going to work that tendon all the way down, and typically it's going to be this joint in the first or second knuckle here where you're going to have that problem with the trigger finger. So we're going to work that area typically the most. And then I'm also going to follow it up into the actual palm itself, because again, that tendon goes all the way up into the forearm. And sometimes we'll actually treat into the forearm as well. Because again, if this is tight up here, it could be putting extra tension on the actual index finger. So again, what it's going to look like, we're going to work that whole tendon all different directions and then trace that tendon all the way up into the palm, and then, like I said, even up into the forearm. And again, this works really well. The patient can actually feel the injured tissue. What it feels like are little ridges or bumps that we're going over, and then when we get over normal muscle tissue, you don't feel anything. So it's very helpful for the patient to understand, okay, that's the problem spot, we need to work on that. The second technique we're going to use to fix trigger finger is called focus shockwave. So shockwave therapy is going to send a shockwave impulse into the tissue, and what it's going to do, it's going to help to loosen up any adhesions, break up any scar tissue, and increase the blood flow to that area, which is going to help that tendon heal. So what it's going to look like is we're going to place the focus shockwave probe over the area, and we're going to start it. And what's great about this technique is it's also very diagnostic. So What I mean by that is when we get over the problem spot, it's gonna feel dull and achy, like, ooh, that's the spot. And then when I get over a normal area, you're not gonna feel anything. So in this case, if I'm feeling a problem right here, which is the typical spot where we'll feel the problem, is we're gonna focus that shockwave right over that area, and that's gonna help to break up any adhesions. And what the patient feels like this is like a deep, dull ache when we get over the problem spot. This is a very effective treatment, can get very deep into these problem areas and to help break up any scar tissue. And again, what I'm gonna do is I'm gonna trace the whole tendon into the palm, because again, some of the problem may be actually here versus actually in the tendon here. And so we're gonna work this whole region to help break up any of that scar tissue. So the second technique we're gonna use to fix trigger finger is called shockwave therapy. The third treatment technique we're gonna use to fix trigger finger is called laser therapy. So deep tissue laser therapy is going to help to calm down that irritated tendon. Like I said, one of the most common causes of trigger finger is inflammation in the tendon, which doesn't allow that tendon to slide properly. So laser therapy helps to increase the blood flow to that area and help to reduce any inflammation and swelling in that area. So what it's gonna look like is we're gonna turn the laser therapy on, and you're gonna see like a red aiming light as I take it over the actual tissue. And what the patient feels is a soothing, deep, warm sensation. And again, what this is gonna do is gonna help to reduce any inflammation inside that tendon. And again, we're gonna work the whole tendon into the finger and then into the palm. And then even sometimes, depending on how tight things are, we can work the forearm as well. We use this technique to help reduce any inflammation in that tendon and the surrounding tissues. So laser therapy is the third technique we use to help fix trigger finger. So those are three techniques we use to help fix trigger finger. So if you're suffering from trigger finger, try to find a provider that does Graston Technique, focused shockwave therapy, and laser therapy. Those are the most effective treatments to help fix trigger finger. And the other thing you want to do is, like I said, make sure you are wearing a support over that tendon while it is healing, and try to avoid sleeping with your hands clenched like that, because that'll help reduce the stress along that area. And obviously, if you can reduce the amount of repetitive stress that you're applying to that area while you're working or doing activities, avoid that while it is in the healing process. If you have any questions about trigger finger, reach out to me at 703-912-7822 or schedule online at novacarwellness.com.